diagnosed with a horrible disease, a bad luck disease. And I say bad luck because there's some things we have no control over. Yes, the world is fat, sick, weak and diseased, 80% according to the experts, because we eat ourselves into the disease, or we are inactive and we get sick because our body's wasted and rotted away. But there are some really bad luck diseases, and particularly in children where they're born with it. Like, that's just horrible. Or you get diagnosed with something that you have absolutely no control over. It's just some horrible thing in your DNA or your genetics, or both parents came together and something horrible happened and now you're sick. How do you deal with that? And for me as an exercise professional and somebody who is an educator in being healthy, fit and strong, the healthy part is usually a choice. But sometimes the healthy part's not a choice. It's something that's, you are unhealthy because bad luck, and I can't put it any other way. So the question is always this: could you handle everything better if you were fit and strong? So even if your body is doing horrible things, it's not functioning effectively, it's been infected with something yucky, is it possible that if your body is fit and strong, you'll be able to handle it better? And the experts say yes. From all the horrible terminal diseases, whether you get it at childhood or 20 years of age or 60 years of age or 100 years of age, if your body is fit and strong, you will be able to handle it better. Isn't that great news? But it's interesting, we live in a world where that doesn't seem to be the focus. So when you go to the doctor or any medical professional anywhere in the world and you say, I've got these symptoms, they go to it's a medical database really, and they look at the symptoms that you've got and they diagnose you. Now the challenge of course with that is that those symptoms are, well, they could be related to lots of different diseases. If you go to 2 or 3 different doctors, you might get different interpretations of that particular database of the disease that you've got. Medical misdiagnosis is the 3rd biggest killer in the world when it comes to health. So we can say, oh, healthcare is awesome, and I would hope that it is, but very, very sadly, it's the 3rd biggest killer in the world where the doctor makes a mistake. So that's always a great place to start, isn't it? Get more advice than one doctor, because what if that one doctor's wrong? And then why don't they ask why? I've been to so many different medical professionals. I've been an exercise professional all of my life with literally thousands of clients. And many, many, many hundreds of my clients have asked me to go to the doctor with them, to the psychiatrist, to the psychologist, to the counsellor, to the orthopaedic surgeon, to the physio, to the chiropractor. Please come with me, Rowie, because they speak in mumbo jumbo and I don't understand. Could you please come with me? So I have been to multiple medical offices. And what I've never heard is this, never. Now, I'm not saying it doesn't happen, but I've never experienced it, where the medical professional has said, this is what you've got, and this is why you've got it. Why did this happen to you? Just, this is what you've got, and this is the medication that you have to take, or this is what you've got, and this is the medical intervention that you have to have, the surgery or the injection or the pills, powders, and potions, but not, let's find out why you got it in the first place so that you never get it again. Now, the why is interesting because there's a lot of diagnosis that say, well, you've got this disease, and the people that have this disease, it's because of. So you could say, well, that's a why. But I want to know why I got it. Why am I unhappy? Why do I have coronary heart disease? Why do I have type 2 diabetes? Why you've told me I'm depressed? Why? But the doctor should, surely a medical professional should ask that question. Why do you think you're depressed? Why do you think you're unhappy? Why do you think your arteries are blocked? Why do you think your heart doesn't work effectively? Why do you think your brain has, a stroke is a heart attack for your brain, so it's a brain attack. Why do you think that happened? And if we find out why, are we more likely to then be able to fix it? Because we could stop it from happening again, or we could, okay, now we know why, let's do the things that are going to stop it from happening again, or let's do the things to reverse it so that we can get you back to healthy. Now, I'm coming at you from I'm an old lady. I've been to very many, many medical practices and offices and doctors and psychiatrists, and And what's really funny is that I don't go to the doctor personally. I don't go to any other medical professional because I want to learn for myself. So I'm really privileged that when I go to see a medical professional, I'm the person that asks the questions. And my all of my clients have said, wow, Rowie, thank you so much. Now, just as a side note for that, if you go to a doctor, medical professional, any professional for that matter, and they can't explain to you in simple language what they're doing and why they're going to do it, then what's that all about? There's a great quote for that. A genius will take something really complicated and make it really easy to understand. Somebody that's got a really big ego will take something really simple and make it really complicated and hard to understand. And I use being healthy, fit and strong as an example for that because it's very simple. It's not complicated to get fit and strong, but there's so much controversial, contradicting information about it that it seems really hard to understand. A lot of people even say that about their personal trainer or their exercise professional. I don't know what they were talking about. They were talking in a language that I don't understand. Here's a great thing. If a 5 or 6 year old can't understand it, then you probably don't know how to explain it well enough, which means you don't understand it well enough. Which is why I've been to so many doctors' offices and I've asked the questions. Why did this happen? Explain to me this medical intervention, which is supposed to prevent. But we don't talk about prevention, do we? We talk about fixing and maintaining and controlling. But we don't talk about how do we get rid of this thing so we never get it again. I wish prevention was a big tool. And here's an interesting thing, and this is a really personal thing. Whether you've got a cold or flu, whether you've got a broken leg, whether you've got a terminal illness and all the things in between, are you the fittest and strongest you can possibly be so that you can handle that stuff? If you're an elite athlete and you get injured, elite athletes tend to recover quicker than the general public because they've got a fit, strong body. If you've got a fit, strong body and a positive attitude and you get fresh air and sunshine and you laugh a lot, is it possible that it doesn't matter what you've got, you'll get better quicker? But I'll go a step further. Is it possible that that is the foundation to prevention? If you are getting fresh air and sunshine, if you sleep deeply, if you're hydrated, if you eat real food, and if your body's really fit and strong, is it possible that you won't get most of the diseases? And I share that with you very passionately because all the medical professionals that I've been involved with will give me a number somewhere between 80 to 90 to 95% of all medical challenges are caused by humans themselves because of what they eat or their inactivity or a combination of both. We've become fat, sick, weak and diseased because of what we've done to ourselves. Now, the bad luck diseases, whether that's 20% or 15% or 1%, those bad luck diseases are still handled so much better if your body's fit and strong. So and I'll use this another classic example, I always get sick in winter. I always get a flu or a cold in winter. Well, of course you will. If you tell yourself every winter I'm going to get sick, you will. If you tell yourself when I go out in the cold I get a sniffle, you will. Your brain's a very powerful tool and it will do what you tell it. So if you say I feel sick, you will. If you say I'm having a fat day, you will feel fat all day. What if we live by the mantra of I'm a healthy, fit, strong, lean, energetic person. I'm going to stay that way for the rest of my life. Now you've got your brain on track. And is it possible that if your brain's on track, then you're more likely to do the things that will keep you on track? The goal here is to keep you out of the doctor's office, out of the hospital. It's one of my very personal goals. Because of medical misdiagnosis, the third biggest killer in the world is doctors making a mistake. I don't want to go to the doctor, and I definitely don't want to go to hospital because sick people go to hospital, and if a healthy person goes to where sick people are, they usually end up sick. I also don't want to be a strain on society because medical stuff costs a lot of money. And if you're constantly going to the doctor or the hospital or you need medical interventions, you're costing the world a lot of money. And if that number is 80 or 90% of people who go to the doctor or the hospital, it is preventable by being a healthy person, being a fit and strong person, surely that's irresponsible. That's taking advantage of a society that's meant to be looking after bad luck diseases. And I'll rephrase that. I want our doctors to be focusing on the bad luck diseases, not the ones that humans are giving to themselves by mouth or inactivity. And I'll use a classic example. Type 1 diabetes has no cure. They don't know how to get rid of it. Type 2 diabetes is completely preventable and curable by being a healthy, fit, strong human being. Every overweight person that's got type 2 diabetes, once they get into great shape, get fit, get healthy, lower their blood pressure, lower their resting heart rate, of course their blood sugar levels come down because they're burning up the sugar that's in their bloodstream, their type 2 diabetes goes away. I'll give an example of that. I worked with the Biggest Loser television show on quite a few episodes, and everybody that came into the house that had type 2 diabetes because they were obese, when they left the house and they were no longer obese, they didn't have type 2 diabetes anymore. So I don't want our doctors, and they are focusing on type 2 diabetes. I want our doctors, our endocrinologists, to be focusing on type 1 diabetes. Because if you've got a child with type 1 diabetes and they have to live with a monitor or injections or insulin challenges for the rest of their life, I want that to be cured. But the doctors don't spend too much time there because now it's one of our biggest killer diseases, type 2 diabetes, completely preventable and curable by being a fit, strong human being. So why am I banging on about this? And I'm obviously very passionate and sometimes I even get a little bit angry because I don't want to be a drain on society. And if you don't have to be a drain on society, why would you choose to be? Why would you choose to be fat, sick, weak and diseased if you don't have to be? If you want to be healthy, fit and strong, lean and energetic for the rest of your life, it does not fall out of the sky in a pretty pink jacket box. You have to do the stuff that keeps you healthy. And that's why I'm out in the fresh air and sunshine every day. That's why I'm really fit. That's why I sleep deep. If you have a healthy endocrine system, you can't become overweight because your hormones tell you to stop eating when you're full. You don't have bad sleep because you go to sleep when you're tired and you wake up when you're not tired anymore. You drink when you're thirsty and you stop drinking when we're not thirsty anymore. You don't have emotional challenges in your life because you are in control of your emotions, not the other way around. That's what a healthy, fit, strong human being is, and you can be one if you choose to be. If you choose not to be, then you have to accept the consequences of going to hospital, being sick, being depressed, being fat. Yuck, 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 and yuck. I don't want to live my life like that. How about you? Most importantly, I don't want our kids to live like that. So I want to be the living, breathing example for our children that you can be healthy, fit, strong, lean, and energetic for your entire life. And you can live your life to the max every single day. Live your life to the max. Woohoo!